All right, let's talk about vision. Um, Before we just jump right into the structures of the eye, let's talk about the accessory structures of the eye. Obviously, you know what your eyebrows are. Your eyebrows sit on top of what's called your brow ridge. Your book calls it something else, a little more scientific, but your brow ridge is that uprising of bone that helps to create the eye socket above the eye. And the whole purpose of your eyebrows is to help shade your eye and to catch debris. Your eyelashes, they also trap debris. And every single lash has its very own gland, kind of like when we were studying skin. And if you've ever had an infection of one of those glands where it has gotten swollen, that is a stye. Okay, so on our diagram here, we've talked about eyebrows and we've talked about eyelashes. Of course, there's upper and lower eyelashes. We studied this muscle, the orbicularis oculi, so that's one we might just want to throw back on our notes since we've studied that before. The conjunctiva is a type of film on the surface of the eye, and it helps to kill certain kinds of bacteria. If you get an inflammation of the conjunctiva, that's pink eye, and that's conjunctivitis. When it comes to the eye, we know that the eye is supplied neurons and communicates with the occipital lobe of the brain via the cranial nerve pair 2, the optic nerve pairs. And let's see, here are the sebaceous glands that are associated with each eyelash. And so that's pretty good as far as the external accessory structures of the eye. Let's talk about the lacrimal apparatus. You can see it typed out way over here, but I'll rewrite it for you. The lacrimal apparatus is responsible for creating your tears. You have two lacrimal glands, and they are superior and lateral to each eye. And so you have a right and a left. There are ducts that come from the lacrimal gland that secrete your tears. You should be secreting tears all day, every day. When you over-secrete them because of pain, sorrow, or other reasons that would lead you to cry, then you can overproduce those tears. They'll go over the lower lid, and then that's what crying is. So as you secrete a normal amount during the day, they will flush across the eye. If we follow the arrows here, they will collect in the corner of the eye in two openings that lead to a lacrimal sac. That leads to a nasolacrimal duct, which means it's going to deposit those extra tears in your nose. And so that's why when you get into a really ugly cry, your nose is going to start to run as well. All right, let's talk about the extrinsic muscles of the eye. They have specific names, but I just need you to know that there are 3 pair. The first pair is responsible for allowing you to be able to move the eyeball up and down. The second pair allows you to move the eyeball left and right, also known as towards the midline and away from the midline. And then the third pair, every mom's favorite pair, rotates the eye. So that allows you to roll your eyes. And so that's going to rotate. We know that the cranial nerve pair that we studied in the last chapter that are responsible for these 3 pairs of nerves are the oculomotor, and that's nerve pair number 3. The trochlear, you guys did a great job on this chart on your last test, which is nerve pair 4, and the abducens. The abducens would be pair 6. Those are the cranial nerve pairs in charge of the 3 pairs of extrinsic muscles. You don't need to know their individual names. Let's talk about the anatomy of the eye. Okay, so let's start to just kind of go through this anatomy. And again, this is just memorization, which you're really good at doing. All right, the outermost layer of the eye is the sclera. It's the white part, and it goes clear in the very front called the cornea. So the cornea is an extension of the sclera. The very middle layer of the eye is called the choroid layer. That's where you're going to find the blood vessels and the nerve tissue. So you can actually scratch your sclera and it not be very painful. But when you get to the choroid layer, that's where a lot of your nerve pairs are found. An extension of the choroid layer here in the front is called the ciliary body. And the ciliary body is made up of a muscle, and that muscle can either contract or can relax, which will change the shape of the lens. We'll talk about that later in a minute. An extension of the choroid to the very front of the eye is the donut-shaped iris. The iris is the colored portion of your eye, and it is also the portion that's responsible for changing the size of your pupil based on the amount of light that you are exposed to. So the iris is a continuation of the choroid layer from the ciliary body, and that is the colored portion of your eye that controls the shape and size of the pupil. The lens then is the portion of the eye that allows for the greatest amount of focusing, and we'll talk about the lens more in just a bit. The area here that is behind the cornea, but in front of the lens, is called the anterior compartment, and it's filled with a watery substance called aqueous humor. The area behind the lens is referred to as the posterior compartment, and it is filled with a different kind of substance called vitreous humor that has the consistency of uncooked egg whites. You will see that when you dissect the eye. From the ciliary body are tiny little extensions referred to as suspensory ligaments, and those suspensory ligaments will put pressure or will remove pressure on the lens to allow the lens to change shape depending on whether you're looking at something far away or something close up. The fovea centralis is like the sweet spot of the retina. So this portion here, shown in yellow, is the retina, and that is the portion where we project images in order to see. The most focused portion of the retina, where we have the most amount of neurons for seeing color, is called the fovea centralis. Here, this whole extension on the back side of the eye that keeps your eyeball in the socket is the optic nerve. And again, 3 layers to the eye: sclera, choroid, and retina. And those are a table of functions of the different parts of the eye in case you want to go back over those again. So the function of the lens is to allow for focusing, and the scientific word for that is accommodation. Accommodation is changing the pressure on the lens in an effort to be able to focus. And that depends on whether you're looking at something far away or if you're looking at something close up. And what is going to happen as an image is moving through the different media of the eye. So the media are the layers or the fluids of the eyes. That's the media. And so as light passes through the media, the pathway of the light will be refracted. The media will refract the light. And that just means change its direction. And so when you're looking at something like this rose, by the time the light from the surface of the rose passes through all the different media of the eye, the actual image will be projected upside down, because you will completely refract the light and you will completely flip it upside down. That image then will be sent by the optic nerve to the occipital lobe of your brain, where you will correct that. You will correct its appearance. And I'm sure there's a disease where you can't do that, but I'm not really sure what it's called. So the different media that you will pass through is the cornea first. Then you'll pass through the aqueous humor second. You'll pass through the lens third. And your fourth media will be the vitreous humor in the posterior chamber of the eye. By the time the light passes through those 4 media, the light will be completely refracted. The image will be projected upside down. If you are looking at something that is far away, the ciliary muscle will be relaxed. When the ciliary muscle is relaxed, it actually flattens the lens. because it puts a lot of pressure on the suspensory ligaments when the ciliary muscle is pulled back and relaxed. So that is going to flatten the lens to allow you to see things that are farther away. If you are walking and you are looking, and your book talks about walking, taking a walk in the woods, and you see something close up like a rose, then the ciliary muscle will contract. By contracting, it will pull the muscle itself down. That will relax the ligaments, and when the ligaments are relaxed, then the lens is going to take a rounded shape, and that's going to allow you to see things close up. When you get to be about my age, you begin to recognize that your lens is not as pliable as it was when you were younger. And so if you've ever handed something to someone and they've had to hold the object really, really far away from them, like extend their arm as far as they possibly can, that is because we lose the ease of accommodation as we get older. And so some people will use readers that you can buy in the drugstore in order to help them with seeing things that they need to see up close. What allows you to see and see color are two kinds of neurons called rods and cones. Cones have a rounded type of appearance to them, and here you can see two of them in yellow. Rods are a little bit longer extensions, and rods allow you to see. So if it's super dark in a room, but you can still make out shade, everything will be in shades of gray because there isn't much light. But it still allows you to be able to see, unless you like take that tour at Mammoth Cave where they like completely turn the lights off and you can't see anything. But cones allow you to be able to see color, and cones are completely stimulated by the intensity of the light. So the brighter the light, the more vivid the color will be for you. And so that's why if you have ever used a dimmer, you can like literally see how color is intensified by using the dimmer switch on a light switch, because it has everything to do with the amount of light. You have three different kinds of cones. You have red, blue, and green. And if you are born with a disorder of your cones, then that is referred to as colorblind. That is an X-linked, sex-linked trait. So it affects boys more than it does girls. And so this simple test here, if you can see the 7 and the 3 in the middle of this test, then you are testing normal for your color portion of your vision. And if you cannot see that 7 and then that 3 in the middle of that little test there, then you may be experiencing some form of colorblind. So the retina is a really, really thin portion of the back side of the eye, and that's where we're going to find our rods and cones. And so here we can see the rods and cone layer shown here and here, and these blue-tipped rounded neurons would be the cones, and then all of these other ones would be the rods. And when the light rays hit them, then these are photoreceptors, which will pick up on the light and the intensity of the light, and that will then send their neuron impulses towards the back of the eye, which will gather here at the optic nerve, and then will shoot that information to the occipital lobe of your brain. Specifically right here where the optic nerve begins, there are no rods and cones, and that is your blind spot. We'll test for the blind spot next time we're in class together. When you are looking at something, anything on the left side of your visual field will be actually processed in the right side of your brain, because where your optic nerves come into the brain, they crisscross at what's called a chiasma, and the nerve pathways can change so that what you're looking at through your left visual field will process in the right side, and what you're looking at in your right visual side will process on the left side of your brain. Some common eye abnormalities: nearsightedness. Nearsightedness is also called myopia. That is where you have an eyeball that's too long. So instead of focusing on the sweet spot here, the eyeball extends too far. And so that long eyeball is going to focus the rays of light in front of the retina. And so you're going to need a lens that's going to help you with that. So if you can see okay near, but you need your glasses to go and watch a movie, you're nearsighted. You have myopia. If you have hyperopia, that is farsighted. Hyperopia means that your eyeball is too short. And so where we would normally focus the view of the light rays is we can't get to that point because the eye is too short. And so that's farsightedness. You can see just fine far away, but close up is tough on you. So you need a lens for that. If the surface of your cornea is not rounded perfectly, then you might be suffering from astigmatism. It's not a stigmatism, it's called astigmatism. That's one word. And so I have an astigmatism on my left eye, so I wear a corrective special lens for that. Macular degeneration is a super common type of um, way of losing your vision. And macular degeneration happens at the fovea centralis, where there is a disruption of the blood flow, either too much or not enough, to those particular neurons. And so what you can see in the images here is where there is kind of a blurry spot on your fovea centralis. And so it kind of creates this halo effect, which is a really common type of vision loss, whether and that can be caused by trauma. So if you watch the Today Show, their lead commentator, Savannah Guthrie, her son threw a toy at her and it hit her in the eye, and she had to she suffered a partial tear of her retina and had to have surgery and deal with that. And I think she still has some issues with it, but it's also can be age related. Okay, that's it.